From our nation's capital, this is the Washington Report with Minnesota Congressman Rod Grams. An inside look at issues affecting the people of Minnesota's 6th Congressional District.
Hello, I'm Rod Grams, and thank you for joining us for this edition of Washington Report. Healthcare reform. It's been dominating the headlines now for months, but when it comes to the details of the many plans now being considered, how much do we really know? To shed some light on the major health care plans before Congress, two special guests are with me today. They are Don Nickles, Senator from Oklahoma, and Cliff Stearns, Representative from Florida, who are leaders in the health care debate, having proposed their own major reform plan, a plan that puts consumers in charge and not the government. And gentlemen, I want to thank you very much for taking the time to be with me today to talk a little bit about this, because of all the meetings I've held over the past 2 months in Minnesota, from one end of the state to the other, the majority of the time has been spent now on health care, because the headlines and all the rhetoric in Washington has driven it to the front page or to the front burner, so to speak. So basically, I'd like to ask both of you to start, because we want to talk a little bit about the Consumer Choice Plan, which you both are the authors of. Where is the debate on health care right now? And where is your bill stand in answering some of those questions in the debate? And Senator, I'll start with you.
Well, Rod, a lot of it, with the President proposing his package, President and Mrs. Clinton, they've proposed a massive expansion of government involvement in health care. And I think of a state like Minnesota, which is a great leader in health care reform. You've got so many people that have done so many innovative things. A lot of that innovation is just going to be suffocated if the President package is passed, because most people aren't aware of it, but if the President was successful, almost every health care plan in America would be against the law and would have to be replaced by a government knows best plan. Government's going to design it, government's going to say what benefits are in it. If the benefits aren't in it, you're probably out of luck. This idea of having a national benefit board, well, appointed by President and Mrs. Clinton, and they're going to design the package. Congress is going to have some involvement, and then people are going to say, wait a minute, you didn't cover this, and I've got a relative that has this problem. So before it's all said and done, this is a package that's going to be enormously expensive. It's estimated by the Congressional Budget Office right now, the President's package is to be about $5,565 per family, almost $6,000 per family. That's too expensive for a lot of people, for a lot of small businesses in Minnesota and in Oklahoma and Florida and other places. They can't afford that kind of a package. And so the President's saying, hey, you have to have this very expensive package, and we're going to mandate that business pay at least 80% of it. You're going to put millions of people out of work. We don't want to do that. So we've tried to come up with a different alternative, one that would allow people the option of choosing what kind of benefits they want, different benefits with different cost, and to put the individual in the driver's seat instead of having the government say, government knows best. We think individuals know better about their own family, and so we try and empower individuals and give them a great deal of flexibility in purchasing their health care, just like they purchase their homeowner insurance, just like they purchase their auto insurance. And frankly, it will be very positive, too, from the total cost of health care, because people are a lot more frugal with their own money than they are with government money or their employer's money.
And they spend it more wisely.
That's what I meant.
Yeah.
And so I think there'd be some real savings, and people would have more or less recapture control of it. Instead, the present system we have, the tax code, it benefits a few people. It doesn't do anything to help a lot of people. We say, wait a minute, let's take the tax benefits that go to a few. Let's give them to everybody. Let's try and make health care, the assistance that the federal government gives, let's try and make it available to everybody in America, and we do that through tax credits.
Representative Stearns.
Ron, I'm pleased to be here, and I want to compliment you for talking about the Consumer Choice Bill back in Minnesota and letting the people back there know how important it is to have choice. As you pointed out, this is a very, shall we say, controversial time, because there's so many bills out there. And there's a bill that's pretty much a one-payer system, the McDermott plan. And there's other bills that are out there, like the Clinton plan and the Cooper plan. But our plan, which is very unique, is free market oriented. In fact, it's the only free market plan on the Hill, on the Senate and the House. And I have the good fortune to offer the Nickles plan on the House side, and that you've been one of the leaders on in the choice. And another important aspect about this plan, it's already in operation. You have health care, Senator Nickles has health care, and I have health care, and Mrs. Clinton and the President have health care. In fact, there's 10 million government employees have health care under the Federal Employee Benefits Program. And what we've taken is that and moved it up for all Americans, and also provided tax credits so that the people who are in the poverty line or above get this enormous benefit. So you don't hear many members of Congress complaining about their health care bill. And so if it's good enough for members of Congress, I'm sure it's good enough for the people of Minnesota. So this is a free market plan that adopts off something that's been in existence for 33 years and provides tax credits. And it's right in the tax code so that people will have the incentive and personal responsibility. I mean, I think that's important to say. Here's a health care bill that provides personal responsibility. A person will say, yes, I want this plan. Yes, I want a more comprehensive plan. They make the decision. Couple that with the medical IRAs that we provide in this bill, you've got a terrific package for Americans, and it's already been in operation.
I like to always tell people when I'm out talking to them that the President really endorsed this plan tonight of his State of the Union address when he said that Americans provide us, federal employees, with a great insurance plan that's always there, and we should make sure that every hard-working, tax-paying American has the same coverage. And like you just said, this is modeled after the federal employee health benefit package. So the President outright endorsed the plan, and I applauded him on one good thing that I thought he said.
It's interesting. He made that comment, but he must have been describing our plan instead of his plan, because his plan exempts federal employees. It exempts members of Congress. And the reason is very simple. Members or the federal employee unions have lots of choices. They can choose from dozens of different plans with different costs and different benefits. The President's plan does not allow that. The President has one size fits all designed by government. And so the President talked about, hey, we need to give everybody health care just like we have. I appreciate the endorsement of our bill, but that was not his bill.
No.
And his bill is just the opposite. And as a matter of fact, under his bill, he exempts federal employees until the year 1998. And it's very clear. He wants to get until after the next presidential election because federal employees have told him, don't put us into your system. We don't want it. We like what we've got. And they like that choice. Now, the President also in the State of the Union and also in many of his speeches and Mrs. Clinton's speeches, they talk about, hey, we believe there should be choice in medicine. And I've heard Secretary Shalala say that. I've heard several of the administration witnesses say, we need more choice. Well, their choices are basically twofold. You take the government-designed plan, and you can have that in the form of an HMO or some type of a prepaid health organization, or you can pay 20% more or something and have it under a fee-for-service where you can pick your own doctor. Well, under the HMO type scenario, people are going to pay almost $6,000 per family. If you want to keep your own doctor, you're going to have to pay a penalty on top of that, probably another $1,000 a year. Most people can't afford that. And so when the President's saying he wants to give people choices, he's really saying you have two choices. You take government plan A or government plan B, they have the same benefit. We're going to control the prices. You have to buy from a so-called health care alliance, which is a governmental operation, big government again, where they can regulate prices and ultimately ration health care. Those aren't good choices. And most people, like right now, 99% of all the businesses in Minnesota, they can go out and say, wait a minute, let's negotiate. Some businesses self-insure for some. Some have nice Cadillac coverage. You have some that have less expensive coverage. The President's going to say, no, you don't have those choices anymore. Those plans are all outlawed, and we're going to replace it with big government knows best.
The security aspect, and I've quoted this many times, Benjamin Franklin said, if you give up freedom, which is our choice of health care, for security, the little card, if you give up freedom for security, you lose both and deserve neither. And if the government can give you security, they can take it away. So it's something I don't think we want to transfer our health care, which is probably one of the most intimate things that we can offer for our families and ourselves, is to turn this over to government.
There's no question. And when you talk about the standard benefit package and everybody lobbying to make sure that their package is on there, well, we've got to cover this, got to cover it. It's going to get so expensive. And how can you deny somebody says, well, we want to have this coverage or this coverage? Well, under our bill, they can do that because they have. If people want to have more coverage,
they have the option.
They have the option. We'll give them a tax credit to help pay for part of it. We'll give that government benefit to some extent, but it's their choice. And so that's a very positive thing. But if you end up with this great big package, I've always said if government's big enough to give you everything you want, everybody wants all the health care that somebody else will pay for. But if you have the individual responsibility, frankly, we can't afford it. So I've said, hey, if government's big enough to give you everything you want, it's big enough to take everything you have.
Same.
And if we're going to mandate a package that's going to cost $6,000 or $7,000 per family, we're going to have to be robbing a lot of Peters to give that to Paul. I mean, it's going to be the biggest income redistribution program you've ever seen.
You know, Ron, just one quick point. People can keep the plan they still have now. They have that option. Under Clinton, they wouldn't have that. So, you know, the people that are listening are saying, well, gee, I'm happy with the plan I have. You'll be able to keep that plan. You'll have that option. And that's what also is good about this plan.
And I think one thing this plan offers that, of course, Clinton doesn't, is the employer mandates, or through the employer. This gives more responsibility to the individual by really changing the tax codes so it's employee-driven tax credits, not employer. And this is what is going to give the option where if you want to stay with the plan you have, or you want to choose a plan that gives you the portability that you can have in any health care.
And when you think about it, if a person is young and they don't need a comprehensive plan, they can decide and take part of that money and put it into a medical IRA, build up interest-free. And so I think that's another incentive, and they can use that later for catastrophic, and it starts them in the process of saving.
And that's an excellent point, because you have a lot of people that don't want to pay $6,000, and maybe they work for, you know, a company that's paying $6,000. And we say, wait a minute, the company, you give them the money, and then they buy some insurance. Then they buy at least catastrophic, they'll get the tax credit, and they can put some couple $1,000s or something they want to every year into a medical IRA. They might want to use that to pay for braces. I have 4 kids, and that costs a big hunk of dollars, and hardly any insurance company pays for that. Well, they could save it up and pay for braces. They could save it up for long-term health care. They could save it up for a rainy day, because all of us have health care problems in our families at some point. And a lot of those are unexpected, and some of them right now are coverages or problems that are not paid for by insurance. Well, if they have their own medical IRA, that is their money. And so the tax code is used, yes, they can accumulate this money tax-free, so there's an incentive to save. But again, it's people, wait a minute, do I want to spend my money for this coverage? I'm willing to do it for my daughter's braces. That's my decision, and as well it should be. But I think it's good to have the medical savings account where people could control and make decisions, and then just try and make sure that people have at least coverage to cover the really expensive accidents. You know, you don't want to have people with no insurance, so we try to have some incentives for people, everybody, not just somebody that works for a generous employer, but for everybody to have a tax credit to encourage them to have at least some insurance to cover the really expensive or catastrophic type problem.
Well, I think he's pointed out also that through medical IRAs you can use part of that for your deductible. And you know, right now only people that are self-employed can write off part of their health care expense. But under this bill, every individual in America will be able to write off their health care, including their deductible, and get medical IRAs. That package alone, I think, makes it very sellable, and it turns out to be almost a middle-class tax break. More disposable income for the middle class and for all Americans, in fact, across the economic spectrum. Everybody, poor to rich, is going to have more disposable income with this new tax advantage.
And the big argument is, is it going to be more government involvement, or is it going to be left in the private sector?
That's right.
What about the president's plan? Let's talk about that for a moment. It's been called dead in the water now by some. The latest polls, I think that were just released, show that now the plurality of Americans, 48 to 44%, say they don't like this plan anymore, although after his speech most favored it. And the Business Roundtable, the Chamber of Commerce, AARP, has now pulled back any support for this. Does that mean it's dead in the water, or do we just have to be more careful that we don't slide to Cooper Grandy, say, which a lot of people have called Clinton Light, that would get us to the same place?
Well, I'm concerned about some of the alternatives that aren't quite as bad as the president's, but ultimately you're exactly right. They are Clinton Light, or they are big government light, and you're going to end up with a package that wouldn't be too much different from the president's. Anytime, in my opinion, if you have the government mandating a very expensive, comprehensive list of benefits, we're in serious problem, because the government by nature will overpromise and underfinance, which the president has done. You asked me to comment on the president's package. He has a lot of new expensive programs in there, and he doesn't have the money to pay for them. And so you promise everybody a very nice benefit. The president pulls out his little health security card and he says, we're going to give everybody one of these in America. Well, it's estimated by independent groups to cost about $6,000 per family. Well, you go out and give that to everybody, and a lot of people are going to say thank you very much, and they're going to start running up the bill. And so the cost is going to be a lot higher, I think, than even the president estimated. And he doesn't have enough money to pay for it. He wants to pay for it through cigarette taxes. And I just tell the smokers, bless you, because you're going to pay for everybody's health care. Yeah. But they won't smoke that much. You can't pay for it with just a cigarette tax. And so then what happens? They have all these benefits that have been promised. And once benefits are promised, it's hard to take them back, as you know. So what do? Well, they have to regulate prices, price controls. That doesn't work. And so then they're going to have to ration care. And then, unfortunately, we will be following many of the same mistakes that they've tried in other countries, in Canada and others, where they have to ration, where maybe they have to close the hospitals in November and December, or have vacation holidays and so forth, because
like Ontario and Canada did
exactly
last year.
Just exactly, and it's almost an inevitable result if you allow. If you say, hey, we do have a problem, we've got 15% of the American population that presently does not have insurance. If people think the solution, and I said they don't have insurance, many, they have care in most cases. If the solution is to have the government take over 100% of the health care industry, including the 85% that have affordable insurance now, and we're going to replace that with insurance and health care that is not affordable, I think we've done a lot more damage than good, and unfortunately that's the President's proposal.
Ron, I think we can sum it up by using Representative Cooper's own words. He said, my bill is a cousin to President Clinton's bill, and there'll be a family reunion in the Rose Garden. So what does that tell you? That basically, if his bill is passed, it's going to be not only Clinton light, but it's going to have all the elements and components of the Clinton, with a 5-year sentence that says it can resort to a Clinton plan or possibly a McDermott plan, which is a one-payer system at a state level.
Let me touch on something, because some people have said, well, the Cooper, the Clinton light, that's the next viable alternative, and some business people even say, hey, that's not so bad because it doesn't have the employer mandate. I'm an employer in Oklahoma. I have less than 100 employees. Under Mr. Cooper's plan, I have to buy from a government alliance. I could not buy from a private sector group to provide the insurance. Frankly, right now, in our company, we self-insure for the first several $1,000s. Under Mr. Cooper's proposal, that's illegal. Under Mr. Chafee's proposal, that's illegal. Under Mr. Clinton's proposal, that is illegal. Even though you have companies and organizations and groups that right now are providing quality health care at a lot less expense, maybe half of what the President's proposed, all those plans are illegal. There's so many innovative ideas that I know in Minnesota. I've seen some of the things that are happening in Minnesota that are exciting, and people are getting health care costs down. Well, a lot of those proposals are going to be illegal because under Cooper you have to buy from a government alliance. That alliance is going to set the prices. That alliance is going to end up telling you ultimately how many times you can see the doctor, and most of the time they're going to be saying you can't see the doctor of your choice unless you want to pay, an extra 20% or so. So I think there's serious problems in the so-called Cooper or the Clinton light, or in President Clinton's bill, because of the employer mandates, but also because of these governmental alliances that they are basically saying you're going to have to buy from there. And Cooper's, he says, you buy from the alliance, everybody that's less than 100 employees, but we're only going to give you a tax deduction for the lowest cost plan, which is going to be this alliance. So even if you were over 100 and you say, I'm not going to buy from the alliance, well, if your costs exceed what the alliance charges, and it's going to start out cheap to try and pull everybody in, you lose your tax deduction. So the tax code is going to drive everybody into his so-called alliance, which means that alliance is going to be all-powerful, and again, it's a governmental entity.
Yeah, it's going to step into a single-payer system.
You bet.
Now, on the cost, when you talk about $6,000 to $7,000 per family, which would be 30 to 50% above what we pay now, the cost is very important. The administration said their plan would reduce the deficit $58 billion. OMB said no, it would increase it $74, and there was another $50 billion that they found that they hadn't included, and we all know Reischauer is a proponent or a supporter of the Clinton plan. The JEC, the Joint Economic Commission, said it could be $918 billion over budget. So, I mean, there's a lot of question on cost. Your plan has been independently scored, and that is good news, I mean, as far as the cost.
We've had an outside accounting firm. The Heritage Foundation has worked on this program for many years. It's not something that just came about in the last year or an idea that people have talked about. It's been studied. It's been scored by an outside accounting firm, and it's been shown to be deficit neutral, and in this case it provides everything that we say it does in terms of the free market, and it provides a great opportunity through the tax code to provide incentives. So it's a bill that's not only been scored by CBO, but it's looked at by this private accounting firm, which is the most prestigious accounting firm in America, and deals specifically with health care reform. So we have those numbers to back us up, and as I say, and Senator Nickles will also be talking about this, I think, next week when he goes before the Senate Finance Committee, talking about this whole spectrum of people on their taxes. It'll show that across the board, everybody is better off under this consumer choice bill than any kind of bill like the Clintons is proposing.
Competition always provides the best product at the lowest possible price, and the only way you can do that is in the private sector, or bureaucracy can't do that. What about the charge that the Clinton plan is going to cost jobs? I know we talked to restaurant associations and many other groups, small business people, who say we can't afford that. We're going to have to make tough decisions. Either we're going to have fewer employees, We're not going to be able to give the raises that we want, or we're going to have to cut wages or raise prices on goods and services, which you know what that does. It makes you less competitive, especially in a global market. So the Clinton plan has got some real economic problems with it, as well as the delivery of health care itself.
I think there's no question whatsoever that President Clinton's package, which mandates a very expensive package of benefits in the tune of about $6,000, and that will only grow, will cost hundreds of thousands, if not millions of jobs. Some estimate as many as 3 million jobs. I used to be one of those employers that I used to have a janitor service, and I had some people work for me part-time that I did not provide health care for. If President Clinton's package would pass, then I have to pay a whole lot of money in insurance that I couldn't afford, so I didn't really need the extra people. I was making enough money on my own to get myself through school, so why hire other people? The net result is you're going to have less people. I run a company, or I've been involved with a company, we pay half of what the president says. Well, this company unfortunately hasn't been making any money. So if the president makes us pay something that is twice as expensive, we're going to have less employees, or he may push us into bankruptcy and we have to shut down and everybody loses their job. So that you can't, the president has not figured out a way yet to repeal the law of supply and demand. And his package is somewhere between $2.50 to $3 per hour in cost. And so if you mandate that kind of increase in minimum wage, there's going to be a real loss in jobs. And they try to assume that that's not the case, but frankly it is the case. And so some people right now are working, they don't have health care. And that's unfortunate. We try to assist them by giving them some individual assistance through a tax credit to help them. But if President Clinton's successful, not only they won't have a job, and then they're going to be dependent on government for 100% of their income and sources instead of the situation today.
Ron, I'd like to quote from Laura Tyson, who is the Chief Economic Advisor for the President, former Berkeley professor. She was asked, how many new employees will the Clinton plan provide? She paused and said 50,000. 50,000 new government employees. I think all America is concerned about bringing government bureaucracy down. Certainly with this, 50,000 new employees, and you and I both know how it works. The government starts with this conservative estimate. It could go to 100,000. So when you couple that with the idea that this national board of 7 individuals is going to start out with 100 employees, including a press secretary, I think that gets you a little bit of the idea of where this thing is moving.
I think the health board alone has a budget of about $2 billion a year, if I'm not mistaken. So when we talk about cost and wasteful spending, to start out with a health care board of 7 and to do that. I was having a debate with Senator Paul Wellstone about health care, and of course he's an advocate of single payer. And I saw a lot of people, in about 300 in the crowd, when they were promising everything that they were getting under this plan, they shook their head yes, that if we can have this, we should have it. But they don't address the cost issue, and they don't address the jobs. And I mentioned you're going to put a lot of people out of work in the private sector, not only through the restaurants and the jobs lost in other areas like you were mentioning, but many insurance companies and agents are going to be put out of work. I said, what are you going to do for those? And one of the responses was, the government's going to need a lot of good employees to administer this plan, and that's probably part of the 50,000 that they're talking about.
Ron, you're in a debate with him again. What you want to ask the people in the convention hall, wherever you are, you want to ask them, please raise your hand if you want the best medicine that rubles can buy.
Yes.
And obviously, if anybody who's been over to Russia, the former Soviet Union, can see that the hospitals are not working, there's no supplies, and frankly, that's a result of a one-payer system. And one-payer system in Russia or Cuba or anywhere is not going to change. It's not going to be able to meet the demand.
Now, in the time we have left, I'd like to talk about the chance of it passing. I mean, we could debate health care all day, but if reality is something is going to pass, I believe in this year, because I think the President looks at a window of opportunity between now and August or October, because I believe Republicans have an excellent chance of winning control of the Senate, which would put his health care package in jeopardy or basically out of business. So what is he going to look for? How are we going to react to this debate? And I always say that he would accept any combination of managed competition. How do we get something that talks about consumer choice, that we believe is really what Americans want and not inside the Beltway? How do we control this debate, or at least shift it and get the people involved with this?
Brought a couple of things. I don't think that any one package that's introduced, whether it be ours or the President's or Cooper's or Chafee's or anybody else, that one package is going to pass. You're going to have a lot of different pieces put together. And the President is going to be very much in let's make a deal. And that makes me nervous. I'm nervous as a taxpayer. I'm nervous as a consumer of health care. And one of the most important things is we have a quality health care system in this country. We don't want to undermine it. And I think many of these proposals, well, may be well-intentioned, but the quality of health care And no question, under single payer, and I don't think the President's plan is that far away from a single payer. I basically see it as government taking over the insurance, or not just insurance, taking over health care. And quality will come tumbling down. So we want to protect quality. But I do see us passing something. I think Congress, I mean, there's a whole bunch of us that have been working on this issue that want to do some things. We want to make sure that we cover people that have pre-existing illness so they're not denied. We want to make sure that insurance is truly portable, which it certainly is under our bill. It's not under many. We want to make sure that we make some changes in medical malpractice so we don't have as much defensive medicine that drives up health care costs. So we want to get health care costs down. There's a lot of good things I think that we can agree on in a bipartisan fashion, and hopefully maybe give some tax credits to individuals and make sure that individuals have more consumer choice to where they can choose different benefits with different costs. I think that can be part of a package. A lot of that from our bill that you're one of the leaders on, and I appreciate that leadership, but we can pass a lot of this year and not do anything that would undermine quality health care, and I think that would be the responsible thing to do.
I was talking to some doctors at the Mayo Clinic, and one doctor stood up and said, "We know you're going to do something, we just hope it don't hurt us too much." Yeah. And I said, that's a bad premise to begin with, and I reminded him in the Hippocratic Oath it says, part of it, first do no harm. I said there should be a bureaucratic oath that also says, first do no harm, and that's what you're saying. Let's pass something that is real improvement rather than a government takeover.
Exactly.
Cliff, in the time we have
Because
left.
we saw what happened with the catastrophic bill. You know, they passed something and then it had to be repealed.
Right.
And we don't want to see something like this happen. So I think it's really important for us to continue, and you continue your leadership in this area, so that all America knows there's an alternative out there that does what we need to have done and provides compassion and concern at the lowest economic level, as also provides for all middle class a great break with the IRAs and also more disposable income.
And like all the town meetings, and I'm sure it's the same in Oklahoma and Florida as it is in Minnesota, people say they don't want the government involved in our health care. Not that the government doesn't have a role to play, but it should not take the reins, so to speak, and control what we were going to do.
Not be the referee and the umpire and the cheerleaders and everything, and the scorekeeper. Yeah.
And I think the President said it best when he talked about health care, or not health care, but the trade policy with Japan. And one thing he said is that no trade agreement is better than a bad agreement. And I think if you would take the same thing into health care and say that no health care package would be better this year than to put out something that would be a bad health care agreement. Senator, I want to thank you very much for being with us. Congressman Stearns, I appreciate your time.
My pleasure.
And I appreciate you for watching. We'll be back, of course, again in the weeks ahead and talk more about what is going on in Washington. Thanks very much for joining us.
Thank you for joining us on the Washington Report, which is provided as a public service by this station. Comments or questions for Congressman Grams may be addressed to him at 1713 Longworth House Office Building, Washington, D.C. 20515, or in Minnesota at 2013 2nd Avenue North, Anoka, Minnesota 55303.